Alright, so quickly looking at the management options for a patient with acute kidney injury. Of course, this should be a very important aspect of the lecture, because you talk about disease, you talk about disease, you talk about disease, and people actually start getting scared. Do you understand? Now they want to now know if this particular disease condition has a cure or not. Okay, so for acute kidney injury, yeah, actually has a cure. Okay, has a cure. So look at the various treatment options for it. So it's just all about supporting kidney function while trying to address the underlying cause, and you trying to prevent any complications that will come up. Okay, so for the management principles, first of all, you are trying to identify the root cause. You are trying to identify the root cause. All right. You are trying to identify the root cause. So is the issue happening before the kidney? Is the issue happening within the kidney? Is the issue happening after the kidneys? Okay. Then fluid and electrolyte management. You are trying to see if they are dehydrated, if they have the volume of their fluids is basically low, so that you can be able to, tidy it up again. You understand? Then electrolyte correction. So you're trying to look at all those potassium, calcium, sodiums and all. Okay, if their levels are dysregulated, you are trying to also balance it up. So avoid further damage. So you are trying to look at all those, any agent that will cause further further decline in kidney function. The supportive care, you are trying to look at their nutrition, you are trying to look at their blood, glucose levels control. You are trying to see if they have any infection and how you can be able to prevent the infection properly. So renal replacement therapies too. Okay, you initiate it basically when the issues are getting out of hand. Okay, if the kidney is not being able to cope up with the basic again. Okay, then keep monitoring them, you keep tracking them. As you are treating, you are looking at the waste products, how there's like an improvement in how these waste products are being put out of the body, and make sure that it doesn't actually get to complication. Okay.